Hey, my name is Hannah and I'm going to be your nurse today. How are you feeling? Good. Can I get you to state your name and date of birth for me? Perfect. Thank you, Mr. Lawrence. Before we get started, do you have any allergies that I should be aware of? Okay, good. So I don't know if you've heard, but your doctor's ordered us to place an NG tube in today. So I'm just going to raise the bed to at least 45 degrees. I'm going to gather all my materials, wash my hands, put some gloves on, and I'll explain the procedure to you. Have you ever had an NG tube before? Okay, so what an NG tube is it's a tube that's going to help with feeding. The tube is going to go in your nose, down your throat, and into your stomach to provide nutrients. So to get started, I'm just going to hand you this basin and this cup of water. And the basin is for if any point during the procedure you feel like you're going to be sick. And the cup of water is for during the procedure. I'm going to ask you to take a couple sips of it, and I'll explain that in just a minute. So now I'm just going to measure the tube from the tip of your nose to your earlobe to your xiphoid process. And now I'm just going to mark that with a piece of tape. I'm just going to spread this towel out on you just to keep anything from getting on your gown during the procedure. Now I'm going to lube the end of the tube 2 to 4 inches to help with the insertion of it. So during the procedure, you're going to start with your head back, and when the tube reaches your pharynx, I want you to take a couple sips of water and put your chin to your chest. And those sips of water will help guide the tube down. And so before we even get started, if any point during the procedure you feel like you can't breathe, you can't speak, or you start to cough, we will stop the procedure, reassess, and we'll try again. So before we get started, I'm going to see which nostril you breathe out of better, and that's the nostril we'll use. So can I get you to breathe for me? And breathe for me. And we're going to use your right nostril. So if I can just get you to put your head back, and on the count of 3, I'm going to insert the tube. 1, 2, 3. Good job. Okay, now take a couple sips of your water. Put your chin to your chest. Good job. Almost there. You're doing great. Okay, now I'm just going to secure the tube with this piece of tape on the bridge of your nose and wrap these two around the tube to keep it in place. And now I'm going to secure the tube to your gown to keep it from getting tangled in anything. And now we are going to send you off to X-ray to confirm placement of the tube. And if the tube is in place, when you come back up, this wire will be removed, and that will indicate that we can start feeding. So now we're just going to send you down to X-ray, and I'm going to go document this procedure and how you handled it. Hope you have a good day, and I'll see you in a little bit. And if you need anything, just let me know. Hey, Mr. Lawrence, how are you feeling? Well, I'm Hannah, and I'm going to be your nurse today. Have some good news. Your doctor's ordered the removal of your NG tube. Can I get you to state your name and date of birth for me? Perfect, thank you. So for the removal, I'm just going to raise your bed up into at least 45 degrees. Now I'm going to wash my hands and put some gloves on. So for the removal of the tube, I'm just going to ask you to take a deep breath in and hold it, and then I will pull the tube out. So I'm just going to place this towel on your chest to keep anything from getting on you during the procedure. And I'm going to place the basin in your lap in case you feel like you'll be sick. So I'm going to start by removing it from your gown, and then from your nose. And on the count of 3, I want you to take a deep breath in and hold it. 1, 2, 3. Good job. Almost there. Good job. You can take a deep breath now. just going to clean you up. Good job, Mr. Lawrence. So now I'm just going to lower your bed all the way. And I'm going to go document these findings and how you handle the procedure. So I hope you have a good rest of your day, and I will be right outside. If you need anything, just let me know. Have a good day, Mr. Lawrence.